Here at the Ganwest Municipal Hospital, scores of patients who have come here to access healthcare are not happy because they are compelled to pay money despite being valid members of the scheme. Accompanied by the mother, Sarah Kisiwa has just been discharged from the hospital after spending 4 nights at the facility after being delivered of her baby. She is one of the many patrons who had to pay money for services the facility offered to them. Kisiwa says the National Health Insurance is not simply working. She backs a claim with receipts she obtained from the hospital showing proof of payment.
Insurance,
I have the National Health Insurance, but when I come to the hospital, I am being requested to pay for services including labs and scans. I am surprised that patients are being asked to pay money for services rendered. This is really disturbing.
At the entrance of the Mamobi General Hospital is Rosamond Kodia. She has also been discharged from the facility after being delivered of her baby there. She also expressed shock about the huge sums of money she had to cough up to settle her bills despite possessing a valid NHIS card.
I think it's not working here because they really took me a lot of money. At the place that I delivered, they took me 190 cedis, almost 200 cedis, before I was moved up there. Up there too, I was being charged. The charges are too much. Let's say after giving birth, I've spent almost 500 cedis, and it shouldn't be so, even though I'm using health insurance.
For these patrons, improvement of the scheme to serve its intended purpose must be government's priority. But why would health facilities force patients to make out-of-pocket payment for services they render to them? A health professional with one of the district hospitals in Accra justified why health facilities resort to a cash and carry system instead of relying on the scheme. He said,
"The medicines we administer are imported from outside the country. When the prices of medicines are fixed, by the time it gets to the end of the year, the dollar rate would have changed. Taxes would have also been introduced. So maintaining the initial price would not help the facilities. Prices of most of the things that NHIS cover go up, but the insurance price will not be adjusted to complement it. If you're a manager of a hospital and you buy a medicine for 10 cedis in January, by December, that same medicine costs about 20 cedis, and a patient comes to the hospital, do you expect us to give the medicine to them at the initial price? In order to avoid disagreement with the authority, when a patient comes to the hospital with or without the health insurance card, we make them buy the drugs because the price NHIS pays us is way below the price we buy the medicines on the open market."
The introduction of the National Health Insurance Scheme in 2005 under Act 650 of 2003 was to provide a broad range of healthcare services to Ghanaians through district mutual and private health insurance schemes. The government's social intervention policies to alleviate the cash and carry system, where persons registered with the scheme had to make out-of-pocket payment for services rendered to them by some 8,825 health insurance compliant facilities. However, some valid NHIS card bearers appear to have concerns with the scheme as they are compelled to pay for services rendered to them. A 2022 Ghana Statistical Service demographic report confirmed the phenomenon. The social intervention policy has been designed to cover outpatient services, including diagnostic testing and operations, inpatient services, including specialist care, most surgeries and hospital accommodation, oral health treatment, all maternity care services, including cesarean deliveries, emergency care, and all drugs on the centrally established NHIA medicines list. However, very expensive procedures, including HIV/AIDS, organ transplant, and dialysis are exempted. For now, patrons of healthcare institutions have one request from managers of the scheme, a request that required the NHIS policy to be tightened to serve the interest of the masses. Stanley Niblew's report read to you.